And talking about Africans who are doing something special, Isibor has done just that. After fleeing the Liberian Civil War with her family in 1990, when she was just 16, and living in refugee camps in Guinea for 3 years, Isibor immigrated to the United States in 1993. And in less than 10 years, she worked her way through nursing school, became director of nursing when she was just 24 years old at a major retirement home in Virginia, and now operates her own nursing school in Falls Church, Virginia. Her school consistently ranks at the top of nursing schools in Virginia for the pass rates of students taking the Virginia State Board.
Well, once I came here to the States, got trained as a nurse, I got a job as a director of nursing for a long-term care facility. And while doing that, I noticed we had new nurses coming in that were not properly trained. So what I did was I took up the time to train them and noticed the end result was remarkable. They became great nurses. And so I decided to actually go into the field of training nurses and making sure that we have competent nurses out there.
And it is such a competitive field. How did you get an edge over everybody else to actually establish such a facility? And
once I opened the program, I challenged myself to make sure that our students were properly trained and that after they were done with the program, not only did they have knowledge, but we also focused on compassion and empathy. Now, once the students went out there and started getting jobs, the employers were very happy and started referring other employees to our program. And our graduates were really, really happy with the education that they received and also started referring students to us. And I can tell you, we don't advertise. 85% of our students actually come in through referral from other graduates of the program.
One reason for her success is the phenomenal pass rates of her students who graduate and pass the Virginia State Board exam.
I'm glad to tell you that in 2009, 97.8% of our students passed the State Board exam the first time they took it.
that is awesome.
Yeah. What we do through the program, instead of waiting to the end of the program to start reviewing students and start assessing students' knowledge at the end of the program, we start doing that early on in the program. We've actually used other standardized exams that we administer to our students during the course of the curriculum. Another thing that I do, I spend time in the classroom with the students. I do have instructors teaching, but I'm the executive director that never stays behind her desk. Della and Kathy, today we're going to be working on intramuscular injections. Okay. We've had lectures in the lab. We've discussed giving the patient intramuscular injection, and I would like for you guys to demonstrate that today in the lab. So Kathy, if you are giving intramuscular injection to this patient, what size needle would you pick?
Based on the patient's weight, I would choose an 1.5 inch needle.
Great. And if you're giving her the injection in her arm, how would you call that site?
It's the deltoid.
Sounds good. Delma, can you walk us through the step of giving an intramuscular injection?
I'm using a new alcohol pad. The first thing I would do, explain the patient about the procedure and let her know that it's going to hurt a little bit, and then clean the area in one motion.
Okay.
Dry for a few seconds and then administer the medication at a 90-degree angle. Aspirate just to make sure that I didn't hit a vessel.
Okay. Now, if you saw blood coming, Delma, what would you do?
I would pull out the needle and start a new medication. Then I'm going to cover the patient with a Band-Aid.
Good. You guys did very well. Thank you
you
so much. So with me being very involved and also starting early in the program by administering the standardized exams that are very similar to the board exam, by the end of the program, we can better assess students' knowledge, and the students also become very familiar with standardized testing. When they graduate, that means they're ready to take their state board exam and start practicing. Because what really brings me pleasure is when the students call and say, I've passed my board exam. Thank you, Ms. Joy. And now I'm working at this facility. That's the greatest joy in this business.
Joy Isibor.
A healthcare setting. We have affiliations with hospitals, DeWitt Army Hospital. We have affiliations with several long-term care facilities in the area. We have affiliations with doctors' offices and clinics. So the students must complete at least 404 hours of clinical practicum. The majority of our students, English is their second language. They're immigrants. They've come in from Africa and Asia, and they come into this country and they want to get into nursing. And so what we have is a majority immigrants from other countries. So I'll say about 85% immigrants and 15% American. My father, that was all he did. And at a very young age, he would actually take me with him to his business site, and I would be there and watch, and I saw how he handled things. I did not go to a consultant. I basically used my own intuitions, my own instinct, and I was able to put it together. Sometimes I actually sit and look back and say, how did I get this far? I started very small. I actually started my business with $5,000.
Impossible.
I did. I first started with staffing, supplemental staffing, hiring nurses and sending them to healthcare facilities to work to help supplement the staff. With that, I was able to grow and then decided to go into education, teaching. Started with the nursing assistant training program. Did well with that, and then in 2007 decided to start the LPN program. And for one thing, I am from a very supportive family. So there were times that I had to call my brothers, my sisters, and say, could you loan me some money to pay the staff? And then once I received checks from those invoices, I will give you your money back. So there were hard times. But with the support of my family and with the hard work that I put into it, I was able to succeed and be able to expand to this level.
Could you just give us a ballpark figure of the number of students who have graduated from both the CNA and LPN programs?
We've graduated over 600 nursing assistants. That's the CNA, Certified Nursing Assistants, and have also graduated over 120 licensed practical nurses.
You have done such a great job. To the many students who are themselves immigrants from many parts of the world, what is that one message that you leave with them when they're leaving your doors and going out into the world? What do you have to say to them?
I tell them, don't only focus on how much money you're going to make. Make sure when you go out there you make a difference in the lives of those people that you'll be caring for. Because with that, even at the end of the week, if you get the paycheck, you're really going to feel good about yourself. And make sure, if you're going to be a good nurse, that what you're going to have again is compassion. With that, your employers will see that you're different from everybody else, and you are definitely going to progress. And I also tell them, don't stop being an LPN. Personally, I didn't say this to you, but when I came to this country, I started as a nursing assistant. Then I became a licensed practical nurse, an LPN. Then went and got my RN. So what I always tell them is, this is just the beginning. Go back to school and become a registered nurse.
And the sky's the limit?
The sky's the limit.
And America is what you make of it.
Exactly.
Make the best.
Yes.
And this is Justina Gray for the A-File. Thank you so much for watching. Good night.